political perspective tonight.
The Dan Yorke State of Mind program is brought to you in part by Lookout Rhode Island and Takeo Comfort Solutions.
Dr. Adam Levine is here tonight. He is, he's a former guest here on the program, and we were talking about things, Syria and the like, in terms of, the global perspective and medicine and the like. And he is an emergency medical specialist, works in emergency, also has a real perspective on public health, has got degrees in public health administration, and really understands not just the specificity of all your nitty-gritty questions on the coronavirus, but the world application and the common sense thoughts that we should have on that. So he's my guest this evening. Stay tuned for that. A couple of things happening on a political scene. Pete Buttigieg decided that he was going to step out last night, and this just in, literally as we began taping our broadcast, which we do early afternoons, about 1:38 as we speak. You see it at 7:30 at midnight, of course. Amy Klobuchar reportedly was folding her tent and doing what Pete did, and that is to support Joe Biden for the nomination. I still think that Amy Klobuchar is a viable vice presidential partner for Joe Biden. I think that's a very interesting Midwestern power ticket. So who knows what kind of deal making is going on, but it only makes sense, right? Because Biden has got to really play tomorrow with Super Tuesday. And now that he's got a couple of moderate lane people folding in behind him, makes a lot of sense. So we'll see on that. In the meantime, just a note on education matters. There was a Providence Schools Forum this past Saturday. I attended over at the Juanita Sanchez School. This is Randy Weingarten, who is the president of the Teachers Union National that represents the city of Providence. And I will tell you, she was quite antagonistic with the commissioner. Barely sportsmanlike in talking about the communication problems she's had with the commissioner. We'll talk about that in a moment, but here's a little bit of her after the event.
Everybody who's here volunteered to come here, to come together as a convening to try to say, what do we want for our kids in Providence, and then how do we use collective bargaining to help get there?
We can't ask for a million things. We need to prioritize what would be the most important and that could get us the most success in the urgent amount of time that we have.
The union perspective is to solve problems via contract. The turnaround experts and those who are responsible for it, the commissioner and the superintendent, I can't speak for the superintendent, but the commissioner certainly thinks that a contract's got to be written to kind of mitigate the rigmarole and bureaucracy that surround and stop success. So the twain are naturally frictioned, but there's a personal problem that certainly exists. Dan McGowan from the Boston Globe put a story in today. I actually sat with Dan at this event on Saturday, and he did a great journalistic follow-up after some of the, minor vitriol on the part of the union president about the commissioner. Tracked the commissioner down because the union president was talking, national union president was talking about communication problems back and forth, agreements on dates for events, and it was an antagonistic tone. Dan did a public records request and got the texting conversation between the two. I'd read the Boston Globe online article because it is testimony to where this situation is now clearly fractured, which may or may not be a good thing. Depends on, as the president would say, well, we'll have to see what happens. We'll have to see what happens because this takeover thing, at some juncture, requires some cooperation. Stay tuned. We're going to do a lot on this, I promise you. In the meantime, let's talk about the story of the day. You put a headline like this up, again, early afternoon, it could change. 2 people test positive in Rhode Island. Here's the latest package, this morning's latest update from the DOH's press conference and today's news from the weekend.
Following Rhode Island's second presumptive coronavirus case, Governor Gina Raimondo says their plan is working. She tells me keeping schools a healthy environment is a priority.
What our response is all about is collaboration, coordination, and communication. So last night we were on the phone with all of the school superintendents. We are in contact today again with teachers and with superintendents, making sure that teachers have the supplies they need and making sure that everybody has the information they need. My message is, let's not panic. Don't panic. Be prepared, be smart, reach out to us.
Senator Sheldon Whitehouse also responding to the cases in the Ocean State.
To make sure that the federal response is adequate. They started with way too little funding and an inability to explain where the funding they asked for was going to go. As they negotiate the funding, we're forcing them to make clear exactly where they're going to spend money, and it's kind of driving, it seems to me, their planning a little bit. So that's been I think, a good process.
Yeah, I'll tell you, chicken or the egg, who asks for the money and who puts the plan together? I mean, that's the kind of stuff that Dr. Adam Levine thinks about on a global and broad perspective. Doc, thanks for coming in. Appreciate it.
Thank you.
By the way, is there anything more weary than looking at pictures of the virus? I mean, it's like, enough of the pictures of the virus, for heaven's sake, you know?
Yeah, it's not very relatable for most people.
No, but it scares you. It scares most people, I think.
Well, because they're alien. They're not things that we're used to looking at because you
Right.
can't see them with the human eye.
Right.
And so you're going to be afraid of something that looks totally unlike anything you ever see.
Yeah, you're not afraid of it.
What I would say is that I think being prepared is much more useful than being afraid, and it's especially much more useful than panicking. Obviously, we're all human. We're going to be afraid whenever something new arrives on the scene. But what we do with that fear, how we channel it, I think is what's most important. Do we channel it into constructive activities, such as protecting ourselves and our families and our communities and our country and our world? Or do we channel it into unproductive activities that lead to panic?
Well, you are somebody who has focused on and been a resource for us on, you know, worldwide matters, Middle Eastern matters and the like. And so you definitely have a global perspective. And I know you want to kind of start there. What are you thinking about this? Look, when it comes here, nobody cares about Wuhan, China anymore, right? But what do you think we should be thinking about at this stage of the game about this whole topic?
Right. And honestly, I'm not so afraid about Wuhan, China either, and I'm not so afraid about the United States. What I'm most afraid about is the low-income countries in this world who have very poor healthcare systems, lack of doctors and nurses, and they are going to be hit by far the hardest by this pandemic. They're going to have many more cases than we proportionately in the population than we do here, and many more of those people are going to die there because they don't have adequate health care or health facilities to provide it.
Are those lesser prepared, lesser resourced countries, because you think they are going to be impacted on a more significant ratio, do they slow down by their nature the total world recovery?
Not only that, they can increase the spread of it, right? So if the disease is spreading rapidly in many of these countries, that increases the total caseload and increases the likelihood that it will spread back from there to other places in the world, even to high-income countries. And so that's why it's really important that as a nation, the United States and other leading organizations take a large role in helping countries in Sub-Saharan Africa and Latin America, in South Asia, prepare their health systems to manage and deal with the coronavirus pandemic to prevent the caseload from increasing too rapidly.
Well, some people are going to say fat chance, because it does feel, while the CDC, I think, is doing a full court press right now, it does feel in some ways that this administration waited a while to even get with it here. So if you here in America, as the director of, I want to get it straight, Global Emergency Medicine at Brown University, are talking globally about our country's responsibility in part to secure some of these global issues, right now, we're just trying to get test kits around. So
Well,
what about that?
Right, and this speaks to the importance of preparedness. Once the epidemic starts, you're already way behind the 8 ball, and that's why you need very solid infrastructure at the CDC all the time, even before an epidemic happens. And what we've seen is a decrease in the level of staffing at CDC and the level of support for CDC here in the U.S., but especially for the global aspects.
The president said the other day, don't worry about it, I can bring the doctors in like that.
Well, everything takes time. Hiring people takes time, setting up infrastructure takes time, training people takes time. And so, you know, we already are starting a little bit behind in the sense that we didn't have that infrastructure up and running and in place.
What kind of cuts did the CDC have? I mean, have you been really looking at it deeply? I really, admittedly, have not paid a lot of attention to it other than the complaints.
Well, we've seen some cuts to the CDC over the last few years overall, but we've seen especially sharp cuts in the CDC's ability to support globally countries around the world to prepare for pandemics. And that's really important because when this disease starts in other countries, if they had the actual ability to prevent transmission of the disease in those countries, places like China, places like Iran, elsewhere, then the likelihood of it coming back to the U.S. would be much less.
Do you trust China's testimony on this now? Reportedly, even though I think this morning I saw 500 new cases, the rate of growth seems to have slowed there.
I mean, that's certainly possible, and we do definitely see that in the course of an epidemic. As a larger proportion of the population becomes infected and develops immunity, it's harder and harder for the virus to spread to new people.
Say that again. Larger population infected affects immunity. What does that mean?
So as more people in the population are exposed to the disease, develop immunity to it, then they can't.
How do you develop immunity to it?
So with all infections, our immune system will eventually ramp up and fight off the infection unless we die first, but in the case of this disease, that's unlikely. And so once our immune system ramps up and fights off the infection, it's there and ready the next time the infection arrives. So,
meaning once you get it, you can't get it again.
As far as we know, once you get it, you can't get it again. And one thing that is certain is once you get it, it's very unlikely that you're going to get it again. And so individuals who've been exposed to the disease who have it now have immunity, and so they're unable to get it again, which means that the spread of the disease in the population slows. So only sort of the new people who haven't been exposed to it are available to get exposed and to create new cases.
I'm kind of confused by this in some ways. Is it good that the large swath of people get it so that they get immune to it so it slows down? I mean, it's like chicken or the egg logic, sort of, doesn't it? It's like
that's
weird.
Definitely not how you want it to happen. You want it to slow down due to public health measures
and
that's
containment.
And containment, and that's a lot of what's also been happening in China. They've definitely instituted some strong measures to prevent person-to-person transmission through a variety of different methods. And that's what we want to do here in the U.S. as well and around the world. We want to do public health measures to prevent the virus from spreading from person to person.
All right, so we'll talk about from China to places like Italy, because it seems like Italy is the source for a little bit of a challenge here in Rhode Island. Stay with us.
We announced the state's first presumptive positive case of coronavirus disease yesterday for a person in their 40s who traveled to Italy in mid-February. We announced the state's first presumptive positive case of coronavirus disease yesterday for a person in their 40s who traveled to Italy in mid-February. We also have, as one of the contacts of the initial individual, another person who was with him during that trip, who is also being followed closely, and we have a test that's pending on that individual.
All right, so talking about the global situation, so Italy seems to be leading the league outside China for its infectious number. This morning I saw it was about 1,800 people and 34 deaths. I did the quick math on that. I think that's 0.2% or something like that. Everyone wants to know what the fatality rate is on this whole thing, because the lower the fatality rate published, the more relaxed people get about it, right? The flu is what, 0.01 more or less?
0.1%.
0.1.
So 1 in 1,000 people with
0.1%.
the flu die from it.
Okay, so this one seems to
in
be
the United States in a normal year.
Okay, this one seems to be at 0.2-ish right now from Italy. But of course the world number is larger because it was pretty intense in Wuhan, China from the beginning, correct?
That is correct. And at the beginning of an outbreak, mortality is always higher from the disease because we only test people who are really sick at the beginning of an outbreak. And so they have more likelihood of dying.
And then we look at Washington State, where the two people who've lost their lives, God bless them, are elderly and/or afflicted nursing home patients who had who had significant problems. Reportedly, they haven't listed what, but you can let your imagination work on that. But we don't know how many people are. Reportedly, it's 5-6 weeks of perhaps potential exposure in Washington State, which might be the good news about this,
Right.
correct?
That's the ironic thing, is that there are probably hundreds, if not thousands, of cases that we haven't detected yet. And that's actually a good thing because it means that the mortality rate that we're seeing is actually much smaller than is being reported. Because most of the cases who are getting this are not getting that sick. Most of the people who are getting infected are having mild symptoms. They're not reporting for clinical care in China or in elsewhere. And as a result of that, it means that the disease is not as severe as was initially reported at the beginning of the outbreak.
Going back to the world thing, so Italy gets whacked a little bit. Again, 1,800 cases so far. Gosh knows how many they have, but there are millions of people who live in Italy, right? So I mean, I'm trying to figure out Has anybody on a global emergency management medical basis had enough information to this point to project where the top could be on this from country to country in terms of another number of cases exposed? Is it possible to do that?
To project how many people have already been exposed?
No, who will? You know, what's the top end?
I mean, that is...
where's the point? You know, the president says, hey, when it gets warmer, you know, we're all good, you know. But
the future's still unwritten, and so much depends on the actual measures that countries around the world take, here in the U.S., in Europe, and in countries in the global south as well. So if we take more intensive measures, we can prevent the rise of this disease and the numbers of cases, and if we don't, then we'll see more cases.
Does this thing end up folding in, for lack of a better term, to the portfolio of normal seasonal things to be concerned about, thus the temperature goes down type of thing? Will it fold into a consciousness of flu is what I'm saying?
Sure. I think that as we get more used to it, people will start to be more comfortable with it in the sense that we're comfortable with epidemic flu, or the flu that we see every single year here in the U.S. It's not that anybody would argue that the flu isn't something you should take seriously, we should all get vaccinated, we should all protect ourselves, but there isn't that level of panic associated with it. And eventually with time, that could be the same with this novel coronavirus. It's too early to tell whether it's going to become a seasonal disease and come back every winter, whether it's going to peak and then go away entirely. We don't know yet. But what we do know is that this is a disease that is produces symptoms that are similar to the flu, has a mortality that maybe is a little bit higher, but not demonstrably higher than the flu, is transmitted from person to person at similar rates to the flu. So it's something that, you know, we should feel that we are comfortable with in the sense that we've dealt with this before. When
something is new like this, there almost feels like there's some kind of stigma that goes along with it, right? All diseases carry some level of stigma, and a brand new one with scary pictures about what the virus looks like, you know, like we just pointed to, do that. When someone has told you that they, you know, say down the line, weeks, months down the line, somebody says, yeah, I had the coronavirus. I had the most recent one. Once they're over it, you don't have to treat them like a,
no.
You know, excuse the term. The old term would be, you know, leper. I mean, and again, leprosy is a serious disease, but you know what I'm talking about. You know, you don't have to panic around people, right?
That's right. So, well, once someone has recovered completely from the disease, their likelihood of being able to transmit it is very low. Now, there are some reports of continued viral shedding after people have recovered, but those are likely to be a very small percent of cases and probably don't continue indefinitely in any way. So it's very likely that for the most part, once someone's had this disease, they recover from it, they develop immunity to it, they're no longer going to be passing it on to others. And so there's nothing to fear from them. But, you know, even people who are infected with the disease currently and are symptomatic, the key thing is for them to just avoid close contact with other people so that they don't pass the disease on. There's no reason to stigmatize individuals. There's no reason to pinpoint individuals from specific countries, because now it's a worldwide problem. Everyone is able to get this everywhere in the world, and so we should be level-headed about this and not try and identify certain segments of the population as being more or less likely to have this disease.
All right, when we come back, you know, stuff you should be thinking about. Stay with us. You know, Doctor, you focus on kind of the national scene. And have you been consulted on the local scene at all for DOH and what they're doing?
No, not officially. That's not part of my role.
No, because.
Well, so
what about anybody at Brown? Are they? I mean, there's interconnectivity with Brown's medical operations continually here with the state. There's an expertise there that we tap all the time.
Certainly, absolutely. And Brown University, as well as the Lifespan Hospital System, are working closely with DOH to develop plans and protocols for both the university and for the healthcare system.
So it's not you specifically. I mean, you're an ER. I mean, you do the ER thing. So I asked you before the show, it's been busy with flu, right?
It's true. This has been a moderately heavy flu season for us, and so we've definitely been seeing lots and lots of patients all the way since November.
I can't imagine what it's like for you guys the men and women in the medical field who are just, you know, so important and in many ways so heroic, just to be sitting there watching that garbage come into the ER all day long. It must. You must be a walking immune system, you know?
Each of those are individual people who have, you know, real fear, concern about their disease and need reassurance, need comfort measures need people to provide them.
Well, you
with
definitely have
something
the
to make them feel
bedside
better.
manner. You're the guy they want to see if I come into the emergency room and say, I think I'm dying. I think you're the steady hand that I certainly want to I want to run into. But is it a challenge for the hospitals? Again, I think there's been enough stay home, stay home, stay home. Here's the dynamic that's hard for people is to hear stay home, stay home, stay home. This thing is new and it's a killer. So you go, what do you mean stay home? You know, right?
Yeah, and so that's why I think it's important to put out the messaging that even based on the best evidence we have, for greater than 80–90% of people, this disease produces mild symptoms.
What if I'm one of the 10%, 15%? Blah, 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 blah.
You will know it, because if you have severe symptoms, you will feel very sick, you'll have trouble breathing, you'll have trouble keeping fluids down, and you'll go to the hospital. But if your disease is mild, if your symptoms feel just like the normal cold or flu you get every year, stay home.
And we're not seeing, well, there's reportedly, the one gentleman that reportedly from Italy is in the hospital. We don't know which hospital. The hospital is ready, willing, and able to see you if you need to be seen.
That's absolutely true. The hospitals here in Rhode Island and around the world are open to see patients who have any symptoms, including symptoms of this novel coronavirus.
So they've got a protocol. No one's going to panic in there. It's not like the lights are going to start flying when you walk in with what you might think is coronavirus. And are we testing right now on the scene, by the way, yet at the hospitals for this kind of thing?
We can now have the test completed in Rhode Island, so that...
Turnaround time is what?
My understanding is that the turnaround time is now less than 24 hours. Before it was longer when it had to be sent to Atlanta, but now it's being done in Rhode Island.
So you might be seen, you might be sent home, they'll follow up and call you and tell you you've got it.
Yeah, it depends.
Self-quarantine.
It depends entirely on your symptoms. If you come in and you have respiratory symptoms, they're going to put a mask on you. As of right now, if your symptoms are mild, they're not going to test you unless you've been to one of the countries that are on the CDC list that are very effective, or unless your symptoms become more severe, and then they will test you.
You know, I'm the public address announcer at URI. We had 7,000 people in the building yesterday. Everybody seemed to be going about their business normally. You okay with that? You're good with that?
I do. I think that people who are healthy and feeling fine should just go about their business normally, take usual precautions like washing their hands, avoiding people who are ill. If you are sick, you should stay home. It doesn't matter if it's coronavirus or anything else. You don't want to give it to anyone else.
Do you project that we'll be start shutting down, you know, mass gatherings and that kind of a thing? I mean, what's your gut? I know you can't promise anything. What's your gut tell you?
I can't tell you for certain whether they're going to shut down mass gatherings, but I know that the Department of Health will work in collaboration with CDC to make determinations about what needs to be done to protect the public's health.
It's day to day, isn't it, right now?
It has to be day to day.
Day to day.
We don't know.
Do you think there's a time in 2020 when this thing will more or less be settled down and we know exactly what we're dealing with and everyone's kind of feeling okay about it?
I do. I think in the coming months, whether the outbreak continues to increase or whether it peaks and dies off, either way we'll become more comfortable with it and we'll be ready to manage it.
20 seconds. Is the president correct? Does warm weather help? I only got 10 seconds.
There's no way for us to know for sure at this point, but with other respiratory infections, certainly there's a seasonal pattern. We'll see if that's true for coronavirus.
Doc, thanks for your resource. Appreciate that. Final word when we come back. We'll keep our eyes and ears on this virus situation, but look, we got to go out the world, and the world is turning, and guess what? There's a tax proposal, an increase on the very rich in Rhode Island that we'll talk about tomorrow with one of its key legislative sponsors. And of course, Super Tuesday is going to demand coverage on Wednesday and Thursday regarding that, and we shall promise you that. See you on the radio tomorrow at 3 until 6 on WPRO. Have a great night.